So hi, my name's Stephanie. I'm physiotherapy and I work at the Royal National Orthopaedic Hospital in musculoskeletal outpatients. And primarily we've been using the Attend Anywhere software to conduct our video consultations. Good, yeah. I've been working with them since March, and definitely at first I think it took a bit of time to get used to the technology and the structure of setting them up. But since then, I think I've definitely grown in confidence in conducting the assessments and treating patients over the platform, and finding that I can feel able to do more and more as I get more confident in doing it. Yeah, I think what I found has worked really well in doing these video consultations actually is being able to take the time to go through and guide patients with their exercises. And if you have a really good setup and the patient is in their own home environment, I think you can do a lot with them, and it gives you a really nice insight into how they would do their exercises at home. And I've also found them being able to see me and me setting myself up in a good environment with potentially equipment can help to show them and demonstrate to them how to do exercises, which I think was something I wouldn't have thought would be quite so effective as it has been. Yeah, I think some tricks that I've learned along the way has been to really think about what it is I would do in my next assessment, and try to communicate that with the patient. So guide them as to what environment that we might want to work in, how they might want to think about setting up their camera or their phone or their laptop, so that I can really get the most out of seeing them in that environment. If it's, on the floor doing their exercises or using a certain piece of equipment, I might prep them for that so they have an understanding of what we might look at in the next session. And it just means that that session is as effective, and the time that we use is really kind of used as well as it can be. I think the biggest challenge of doing virtual consultations is often the kind of technology. I think sometimes we have challenges with the connection or challenges with the picture quality. So that can mean that time is taken with actually trying to sort out technical issues. And when we only have short appointment times, it can be quite time consuming and we lose out on patient contact time. But that actually has got a lot better over time as well. We've been working through some of these technical issues, and it's getting easier the more we do it. And I think the other thing that is quite different about doing video and virtual consultations is the admin time and the paperwork time that is needed. When doing face-to-face consultations, often we can multitask and do two things at the same time, whereas doing video consultations, you need the time after to actually write your notes, to send email with exercises. So it just means that the process is a little bit more lengthy and time consuming than it potentially is with face-to-face appointments. I think a positive to that is you get the time to reflect back on the session, and then your notes may be a little bit more robust because actually you're reflecting and you're putting into those notes after the fact rather than trying to do them at the same time. And I also think that this has created a push for making us have more resources for exercises and videos for our patients to follow. And again, then having those resources to send to our patients after the fact, I think means that sometimes the quality of that is better than just what we might write down or scribble down or print off for them at the time, knowing that we have time pressures. So yeah, I think there's a positive spin to it as well.